So what we're looking at, and where a lot of people miss the boat on the psoas, so the psoas hip flexor runs from the front of the thigh through the pelvis to the front of the spine. A lot of people who do manual therapy for the psoas, they stay right at the pelvis. They never really trace this thing all the way back to the top of L1. So there are frequently trigger points that are up much higher. But secondarily, I've just seen, come close to this edge, I've just seen some posts from an academic physical therapist who's just going all the way back to a lot of the cadaver studies and actually, having worked on so many cadavers, saying how this is an ineffective treatment because we have to go through all the viscera, all the connective tissue and fascia to even get to the hip flexor. So my pushback would be pull up. Yeah, that's cool and all because that structure is really deep. Let it drop. However, pull up. How would you explain the result that when you pressure point release this tissue, relax it, you get such a massive improvement? Pull up. And the difference between just doing a contract relax stretch, let it drop, and doing a contract relax stretch after a pressure point release, just the massive amount of improvement you get. So that's cool, it's deep, I get it. You may not be palpating the actual hip flexor itself, but explain the result. That's where people just don't get the connection to what this actually means to the patient.